The following is an Operation Podcast production.
What do you see as the biggest problem facing women's health now in 2025 that you think has the highest potential to be managed if properly diagnosed?
Great question. The biggest health challenge is that we're seeing women younger and younger with lower levels of estrogen and progesterone than ever before at a younger age. So, we've recognized that testosterone, for example, as men used to have higher testosterone as they got older in their 40s. And now younger and younger men are seeing half that levels of testosterone. This is probably something environmental. We can dive into it, but we're seeing exactly the same thing. I'll see 25-year-old women that have the levels, their hormone levels, the same as like a 90-year-old woman. And nobody wants to think that we use this word menopause and perimenopause, and women think that just because they're having a period that everything's okay and normal with their hormones, and they're being told this by their doctors. I'm not menopausal, right? They just say that because I'm still having a period, but we've done a disservice to women because we've defined it by the period, and we shouldn't do that. Hi, I'm Dr. Sarah Daccarett, CEO and founder of Innerbalance, and we do a modern, fresh take on hormone replacement therapy for women. Welcome to Ever Forward Radio. You can still have a normal cycle and be completely depleted in estrogen and progesterone in your 20s and 30s. And the other crisis that's happening is that this is causing a lot of health problems. Women get impacted, I would say, more than men. We see endometriosis being caused by low hormones, polycystic ovarian syndrome. Endometriosis affects 10 million women, at least in the US alone every year. It's extremely painful chronic pain syndrome, polycystic ovarian syndrome. We see post-birth control syndrome where they stop and take birth control and then they don't recover from it. We're seeing anxiety, depression. Women take the bulk of the pharmaceutical drugs in the US because their mental health is really impacted when their hormones drop. We're not recognizing that birth control, what it's doing to women's health. It doesn't liberate them. It's actually making them a lot sicker. We don't make a fake testosterone, for example, and give it to men and take away their fertility and then expect them to handle it mentally and physically. What if I took your testosterone and made it zero? How do you think that you would feel about that? You probably would feel terrible. But we do it to women all day long, and we treat a 15-year-old with birth control for her acne and with no informed consent of what this is doing to her body and how it's impacting her. This is a health crisis that we're doing for hormone therapy in women. And on top of that, we do not have, until I invented my therapy, there's nothing for younger women that's effective for somebody to help her with her periods. All of the HRT formulations that we have, and they were designed for post-menopause. We're talking 50 and above, right? So this is just the tiniest dose of hormone, literally microdoses of hormones, so that you can just get through menopause. It's the philosophy that we've had for women. If you have the capacity to get pregnant, we're not going to intervene or touch you. And if we think you can get pregnant till you're 50, then we're going to wait until your period stops. And then when you're no longer quote unquote fertile, then we'll intervene. This is complete sexist, right? We'll intervene with a male very early on. But if a female has the capacity to have a baby, we won't intervene. And this is, We've got a lot of postpartum depression. Women are really struggling with their hormones. And then the other thing that kind of ties into this is that the chemicals in the environment, the plastics, the pesticides, the parabens, the fragrances, the phthalates, these bind only to estrogen receptors, not to testosterone receptors, right? So they bind to the estrogen receptor in the body, both male and female, and they inhibit our own estrogen from binding. So these lower hormones in the body. And so women are disproportionately being affected by cancer. Everything that's being, all these environmental toxins are impacting women more than they're impacting men. And then we're telling women that they're estrogenic. We're saying that these plastics are estrogen. So now everybody fears their own estrogen. So we're making the problem worse. Women don't want to take the very thing that they need. We don't tell men that testosterone is dangerous for you. Oh my God, your testosterone's too high. You can't take any more testosterone. It's too high. But we tell women all day long, your estrogen's too high. It's making you fat and bloated. And it's giving you anxiety and you can't sleep because your estrogen's doing it. I don't tell you that testosterone's bad. This is so awful that we're what we're doing to women and keeping them away, where it's almost suppression. And I don't think it's intentional, but it's starting to feel a little bit intentional, like all the misinformation out there for them.
So much in there. As a whole, I immediately go, wow, is all of this really that new information? And this is just kind of like we're in the day and age where we have the internet and podcasts and, mass media really covering this stuff more often. So it's more kind of top of mind. Or are we now just kind of like at a peak saturation point of things have just been getting worse and worse and worse for, year by year, generation after generation. And we're at like this tipping point now in female health, women's health, that we're finally going like, hey, like someone has to pay attention.
I think it's a combination, like we are at a tipping point because the environmental stuff is getting worse for women. And then the birth control, we've had it in the population long enough now that we're seeing its impact, whereas we didn't see that in the 70s and 80s. And then also, but women have always gone through this hormone drop after the age of 30, but women were not really, they never talked about it. My mother never talked about it. Grandmother never did. This is like the way that it is. You're suffering. It's part of being a woman. Postpartum heavy bleeding, part of being a woman. Heavy menstrual periods and cramping, part of being a woman. Aging, and it's women. There's a lot of shame wrapped around aging for women. And so instead of just taking the shame out of it and being like, look, everybody goes through it. This is like a universal thing. It happens at like age 30. Literally, if you're 33 and you feel like you're aging, it's just your estrogen and progesterone. We need to normalize it for women. We did for men. So we're like a decade behind. Women's are a decade behind men's health. So I would say 12 years ago or something like that, men were also told that testosterone causes prostate cancer. They were very shy about talking about erectile dysfunction. It wasn't until we really put it out there that, hey, this is a really common thing and it's nothing to be embarrassed about. And we normalized this event for men. And so now men are totally fine taking Viagra and taking testosterone. And they want to they know that it's just okay. And they're like, wait, I want to inject testosterone. It's great. But women, there's still a lot of shame about vaginal dryness, for example, and talking about it and then recognizing that it's really, really, really common. And then that it's okay. And it's not nothing about you or, it's like if a man were to go to a doctor and be like, I have erectile dysfunction, the doctor would be like, oh, you have a health problem. You have a health concern. We need to give you Viagra and testosterone and fix it. If a woman goes to a doctor and says, I have vaginal dryness, he'll say, or the male doctor, or females too, will be like, you need to date your husband. You need to read a sexy novel, use some lube, figure out your relationship. There's a problem here with your relationship. Instead of being if a woman has vaginal dryness, this is a health concern. It's the same thing that a man is going through, that her estrogen and testosterone or progesterone has completely dropped. This is not how, so we need to flip this narrative and let women know. And I think if we were to do that, like we've done for men, then we need to do that like we've done that for men.
It kind of begs the question, is there more of a prevailing narrative around the conversations we are having or not having with our primary care provider based on if we're a male or female, before we even get into the actual health concerns?
It's a great point that you bring out, because men, for example, women have an OB-GYN. So they have this primary care doctor that they go to have babies, and OB-GYNs are great. They're surgeons. They're surgical training to deliver a baby, make sure that you're safe and baby's safe. And then they'll do some cancer screenings. But beyond that, they don't do longevity and hormone replacement therapy. We have zero training in medical school for hormone replacement therapy or hormones in general. Doctors do not understand perimenopause or menopause or endometriosis or PCOS or how it impacts the body. We're trained in medicine for acute care. If you got in a car accident, you come to the hospital, we'll save your life. And thank God, doctors do that. But in terms of a wellness for hormones, there's zero training. But men recognize that they need to go to a longevity specialist or a TRT clinic, right? So they recognize hey, I need to go to an actual specialist to get my hormones replaced. Women, they go to their OB-GYN, right? Because that's their doctor. And so then they'll go to the OB-GYN, and the OB-GYN will literally tell them, estrogen causes cancer, because the OB-GYNs are 20 years behind in the literature. They haven't read any of the new stuff. They're afraid of what they don't know. The OB-GYNs get offensive. And this is not just OB-GYNs. Their primary care physicians as well do this, even the endocrinologists. And they get defensive because doctors, if they are supposed to know everything, and when they don't, they obviously take that personally, and then they push it back on the patient, like, you're the problem. You need to exercise more and diet more, or whatever. It's whatever, your kids are making you tired, your husband's making you irritable. It's like your problem. Instead of just recognizing that they don't even know what they don't know. And so women are being told that they're normal, their labs are normal, that they are too young to be on HRT. They're told all the wrong information by their primary care physician and OB-GYN, and they don't understand that they need to seek help at a specialist. Like, I'm not going to go to a dentist for my back pain. So why are they going to their OB-GYN for hormone replacement therapy is beyond me. But it's kind of like they don't. And so does that make sense? Like, yeah.
It absolutely does. And I feel a little skewed here just because of the nature of, this show is very health and wellness oriented. We bring on incredible experts, scientists, doctors, in a lot of different fields. And we've touched on this before. Also, I come from the healthcare background. I was a clinical health coach and wellness director for a concierge medical practice for several years. So I personally have experience with, not a deep dive in hormone health, but just working with someone and getting them well through physical fitness, nutrition, lifestyle, behavior modification, coupled with directly working with their primary care provider. Also, my wife is a family nurse practitioner who specializes now for years in hormone health optimization, longevity. So I'm hearing all these things, and it's kind of reminding me of this certain place that I'm in my life of, I don't know, you can call it privilege or just awareness, but just, also a lot of it is choice. I have a lot of choice to make myself aware as I am aging, as my family is aging, chronologically, not as much biologically, which I want to get into with you later. And it just makes me think about how many other people out there are going through the same life experience chronologically, but are not by choice putting themselves in these environments to just think differently about their health, to think differently about questions or rapport they should be having with their doctors. What questions are they asking? What questions are they not asking? How in tune are they really with their bodies, and just going, oh, like, I guess I'm just getting older, or, oh, this is just, where I am in life because I had a kid, or I have this illness, or I have whatever, legitimate or not, versus just, no, actually, this could be something that I could bring up with the right professional, with the right specialist, or even just, the right resource to completely change my perspective on my life and probably radically improve my health.
I love it. No, I mean, women need to understand that they are in control of this. Like, they are in control of how they age and their aging journey. It's not just like out of their hands. Like, I kind of think people are like, well, this is what it's like getting old, like you said. And you have the knowledge and the tool set like around you. And when I went through it in my mid-30s, I refused to feel the way that I felt. I was like, there's no way that I'm going to feel this terrible the rest of my life. Like, I don't get it. Like, I'm like tired and getting sick all the time. And like, this is crazy. Like, and so I refuse to accept this as aging. And I think women need to do the same. Like, you can look good and feel good as you age, and it is possible, and it is not too good to be true. And this is like, they just, I don't think women even get it, that I don't think a 33-year-old understands that hormone replacement therapy is even an option for her, and that it's like, that hormones are a foundation for aging well. They're foundational to health. It's like brushing your teeth and washing your face and like taking some vitamins. It's like the most natural thing we can do. And I think if people just women started thinking about it that way, they would have a different aging experience, like an aging journey for sure.
Absolutely. Could not agree more. And I think one area that I want to get into next, speaking of thinking differently, is we need to not only think about our current situation in terms of our biological age, chronological age, good health, poor health, or whatever we're working on. But when it comes to anyone's health, male or female, I firmly believe that there are other aspects we need to really incorporate. And that's looking backwards a bit, looking at family history, heredity, and then like what you were kind of already hitting on a little bit. And those are environmental factors. What's in the air, what's in our homes, pollutants, toxins, microplastics, things like that. So if you can kind of dive into these three categories, especially here through the lens of, let's keep on track with female health, family history, heredity, and environment. What roles do these play in the modern woman's overall health, but especially when looking at hormones?
Yeah, let's talk about environment first, because it's like so much like of an issue for women. As I mentioned when we first started off, that these chemicals are binding estrogen receptors. So we call them xenoestrogens, and some people unfortunately call them estrogens, but they're not. Like what they're doing is when you compete with this estrogen receptor and you bind onto it, then your own natural estrogen can't bind, which we know the protective effects of estrogen, right? Like estrogen's potentially protective against cancer, aging, like it keeps our skin and hair healthy. It keeps our gut healthy. But progesterone is actually our main hormone too. So interestingly, if all these chemicals are binding to these receptors in women, what it will do is it causes infertility because it stops the production or like our own hormones from binding. So we stop ovulating and we need this all to be working for this to happen. And when we're basically telling women that they have estrogen dominance because of these environmental chemicals. These environmental chemicals are causing estrogen dominance. They're going to give you cancer and they're going to give you all these health problems. And so do you kind of see like what I'm unpacking is the problem has all of the terminology. You can't call it estrogen dominance. It's not. It's just chemicals in the environment binding. So what would be the solution or treatment? Like, well, you want to make sure that your estrogen levels are high enough that they're always on the receptors. Like if you have your receptors full of their natural hormone, then those chemicals are less likely to bind to them, first of all. And you can also try to eliminate them. Like we can do everything to eliminate. You shouldn't have those like Glade plugins, for example, all over the house, like fragrances that are in all of the beauty products. Women are like inundated with lotions and stuff to put on their skin and body. You really need to be fragrance free, like chemical free, paraben free, endocrine disruptor free. And so buying things or just putting less on the skin, like taking less showers, using less soap. Like we don't need to be doing that much to our beauty routines, need to be really simplified. And then this would help. And then the food, obviously trying to just avoid pesticides. They're like literally everywhere. So that's part of the problem is you cannot eliminate these environmental toxins. Like you said, they're just like everywhere. So making sure though that your hormones are always optimal is how women can protect themselves and recognizing the signs of when they're low, because then you know you're like susceptible to this.
I want to just highlight a couple of things here while we're still in the environmental aspect of hormone optimization, or really just probably giving a lot of women their hormones a fighting chance. I think if looking in our environment, let's just start with the home. Let's, the woman listening right now, watching right now, she's looking around in her home. What do you think are 2-3 primary areas of the home and or products that you think most women have around them or are putting on them that if they just started by reducing or eliminating these, they most likely potentially could see maybe like in their labs or even qualitatively in how they feel, some semblance of hormone balance?
Fragrance, like would be my number one. Because everything. Are
we talking candles? You mentioned Glade plugins, but just like any scent?
Like scented things, fragrances have like our phthalates and they bind not only why we think they might even cause breast cancer. I mean, we know hormones do not cause breast cancer. I can say it like say it louder for the people in the back, but like fragrances do. They're literally in everything, like in the lotions and the perfumes and the shampoos and the soaps and we want the rooms to smell nice. And this is like, if you could eliminate all of the fragrances in your life, you'd be doing yourself. And it's not a hard thing to do. So that would be something you could just look for. If it smells like something that's got like a chemical in it that made it smell like that, right? Unless you have a natural way to get that fragrance. That would be an easy thing that everybody could do. Otherwise it's much harder to like eliminate. You can try to keep your food in glass containers, but people are busy. So like, I think in practicality, like if you were to just, I think baby steps, like people were just to do one thing, it would be eliminating a fragrance, would help a lot. And I also want women to know that's like, look, there are people out there like detoxing. They're doing all these things to try to detox and they're eating high fiber diets and doing glutathione and like injections and liver cleanses and right to get all these chemicals out of your body. But always keep in mind that like, you don't have to white knuckle it. It's not about like, you don't have to have your diet and lifestyle so strict that you don't have a life, that you can always do hormone replacement therapy. You know what I mean? Like, I don't think young people even know that you can do that. Like if you're a patient with endometriosis, for example, you're in your 20s and you've been told that your only option is like surgery, like a radical surgery or birth control, which is making everything worse. And we can talk about what birth control makes everything worse. And these are your two options and you're, potentially have this problem of like really low estrogen and progesterone, and everything's binding and making your endometriosis worse, hormone replacement therapy is really effective, like a bioidentical estrogen and progesterone for something like this.
How negative is really potentially in the long term birth control for women in terms of hormone dysregulation?
I think if you asked any doctor, they'd be like, well, the literature shows that there's no long-term impacts, but I think this is absolutely not true. Like birth control are not hormones. They call them hormones just to confuse everybody, but it's a synthetic, pharmaceutically made molecule. It's a chemical like it. And they call it similar, make it names that are similar to estrogen and progesterone so that women feel like they're taking a hormone, but it's not. It's absolutely not. It's like a man-made patented drug that binds to these receptors, much like a chemical in the environment would, and it stops or suppresses the production of your own hormone. That's what makes you infertile. And these molecules are derived from testosterone, right? So that's why when women take birth control, they literally feel suicidal, like they're going crazy, anxiety, depression, bloating, weight gain, acne, like they get all of these side effects. And everybody tells them, oh, you just can't handle hormones. And it's like, no, you took away all of her hormones. That's why she can't handle it. Like literally, I don't know if men really understand. Like it's like, it would be the same thing as me making a fake testosterone that binds to the receptor and took away all of your testosterone. You would lose weight, right? Because testosterone keeps men fit. You would lose weight. You would lose your hair. Like you would get anxiety and depression and fatigue. Erectile dysfunction, like, right? Women get low libido on birth control. I mean, but men, it's like we do this to women literally all day long. And we tell them, it's fine. You can take it for decades. You can take it for decades. I get women who are menopausal on birth control. You're like, dude, you're 50 years old. And why? Because they're using it as hormone replacement therapy. I'm like, this is not hormones. Like, and so doctors need to we're part of the problem. Like they have no education. They need to get educated, but they're not informing a 15-year-old, hey, I'm going to take away all of your hormones. They don't tell 15-year-old that. There's no informed consent. And it's not a treatment for acne, right? Birth control, or it's not a treatment for heavy periods. And so a lot of women, the generation that was given birth control for heavy periods as a 15-year-old, it's probably the generation that we're seeing now with endometriosis and polycystic ovarian syndrome and perimenopause and like all these problems in their late 20s, because they never really did have hormones. Right? They never, like, progesterone protects the uterine lining. It keeps it from proliferating. If she doesn't have that, you get something like endometriosis. Like, it's not, you know what I mean? It's kind of should be obvious.
And then what about family history and hereditary factors? It's great if a woman is listening right now, taking awareness into their home and environment, maybe getting some labs, which we'll get into here in a minute. But other concepts she should be aware of, I think, correct me if I'm wrong, is looking at family history. And I believe it's really primarily the last two generations. So your mom and grandmother. Walk us through what we should be looking for in family history and hereditary factors, and how far back should we really be going to get a better snapshot of maybe how to better navigate our hormone health here?
Yeah. I hear women all the time say like, well, my mother went through early menopause or late menopause or this and that. Like, instead of looking at it that way, because we're still, again, defining it by the period stopping. Like, who cares what year your period stops? It's literally like one day of your entire life. Like so women have something so visible, like a period, that we define her onset of fertility and then the end of it with this bleeding. But it's really unfair to her because she can go her whole life and not be healthy, and well, you're having a period, so you're fine. But so like but in terms of family history, and a more important measurement is actually something like a marker, like an epigenetic marker, like COMT. So like all capital letters, COMT. And this big, it's like a big machine that metabolizes dopamine, serotonin, norepinephrine, like so all these neurotransmitters, in addition to estrogen and progesterone. We mostly talk about estradiol in the literature, but it definitely metabolizes progesterone as well. And men have their version, right? So they'll metabolize testosterone really quickly. So I don't know if you have any friends or you've seen men talk about, I need to inject a little bit more testosterone than my friend XYZ, because when I took my labs, it was low, even though I was injecting the same amount as my friend. And it's because he was metabolizing it really fast, because he could have been a COMT metabolizer. And they need more hormone, because this mechanism is really fast in them, and it is a methylation pathway. So that it
I was in that boat. I was sharing with you earlier, and my audience knows a couple of years ago when I went on TRT for right about 14 months, I didn't even take this into consideration until probably several months in. I'm a hyper metabolizer of everything. And exactly what you were talking about was true for me. I started off very low, getting very low dose, and like really needed to like quickly manipulate my dosage in terms of amount and frequency, even getting into a couple times a week, because the same amount comparatively to, symptoms, T levels, free T, sex binding hormone, globulin, and all that stuff was just not equating for other people that I was talking to, or even other guys in my same age. This was when I was 36.
Yeah, no, you're right on. But like women, and so men, I think, are like ahead of us, way ahead of us, like in terms of like talking about this optimization, right? So women, when you get started on my HRT and then like I recognize right away that they're a fast metabolizer, they're like, I think it's too much estrogen. Like they think that they still are in the mindset that estrogen is bad for them. And you're like, no, you need more estrogen. This is a sign that you are metabolizing way too fast. They think their symptoms are from the HRT. And it's like, no, it's because you are blowing through this in like 2 hours. And so like a COMT, generally women, they all fit this, like, it's not a stereotype. It's just exactly how they are. So like, I too am also a fast metabolizer. So like, but you will have mental health in your family. You tend to, like, if you kind of look around you, you're like, everybody here has ADHD and so do I. And there, or like just some type of mental health that you can kind of see, like an anxiety, because ADHD, like a childhood ADHD just turns into adult anxiety. That's all. Like you see a young adult with anxiety,
and even depression. I even noticed I was going through some pretty interesting bouts that I thought I was depressed, and it just seemed to be weird, like very cyclical. And I learned through this advanced genetic testing, I actually hypermetabolized dopamine and serotonin. And so when I have really high highs, like a fun, great weekend or a big great success at work, or any kind of like peak moment in life, it takes me a couple of days longer to kind of replenish that back because I just burned through it so fast. So I would have really high peaks, low valleys, and then I would just feel depressed. And I thought, oh, I have depression. But I learned that it's just really this hypermetabolism of these key hormones. And so then it just allowed me a little bit more information and grace to just navigate those down periods. And then I would bounce right back.
And it's powerful information. Like the fact that you learn that about yourself, you will know it for the rest of your life. And then people with these genetic, epigenetic mutations, SNPs, we call them single nucleotide polymorphisms, they tend to like maybe be addicted to more. Like you have the addiction tendency, even just knowing that you need this more dopamine, right? That you're trying to find, like these people tend to like exercise more. They need actually more exercise. So if you find that you have ADHD and you're kind of like this type of person, you thrive off of more exercise, you do well, you do need it more. And then you need more sunshine, you need more hugs. My kid has it. Like he wants to hug me like every 5 minutes. It's cute, but it's like every time you hug somebody, you raise your dopamine. Every time you exercise, every time you move your body, you raise dopamine. And so if people see that it's a dopamine problem, right? So this thing is metabolizing dopamine really quickly. And what raises for women, estrogen raises dopamine. And so they'll start to really get a lot of problems if they have COMT, and I'll get them early on. So endometriosis is a problem of low estrogen and progesterone. I think there's a connection, I'm pretty sure, between COMT, if you have this gene, and endometriosis. Like there is an early perimenopause. So for example, women are early 30s, it'll hit her harder because she's younger, but she's a fast metabolizer, and whatever she's making is also lower because her ovaries are not functioning as well, right? So she's even worse than somebody else her age. She's like, why am I so different than my friends who are only 33? This is why. It's a genetic thing. It's her genetics playing against her.
So then let's talk some biomarkers then. So now we're kind of getting into genetics and testing. And let's say the woman listening right now wants to get a comprehensive panel. I'd be willing to bet her primary care provider probably won't get this. I know for a lot of guys, correct me if I'm wrong, even women, they won't even give you a testosterone panel unless you're truly very symptomatic. So needing to go to a third party, which there are a lot of great resources out there now, telehealth. Like I said, my wife works for one. So let's talk key biomarkers. What are key biomarkers that should be tested, you believe, regardless of being symptomatic or not? And are there any other tests, such as nutritional, genetic, like we've been talking about, that we should shine a light on here that might be helpful?
Yeah. I mean, the genetic test, COMT, there's other ones that metabolize these hormones quickly, but COMT is so common. Like I would say 30, 40% of the population. Like, so it's really high. Like I see it in my own practice when I had a clinic and now online. And this is really common if you know you're a COM. And then the problem is the genetic results come back as you might be a slow metabolizer. I have yet in my 12 years ever seen a slow metabolizer. So like, I'd love to meet that person that's a slow metabolizer. They're all like fast. And then the unfortunate thing about women, like when you get a testosterone level on a man, he's pretty consistently at one level. Women are like literally all over the place. And that's just because we normally are cyclical. And so when you get an absolute level of estrogen or progesterone or testosterone in her, it could be literally low 1 minute and high the next. And it's because they're
minute by minute, it could be fluctuating.
Well, by hour. Because it's like,
even still,
there's also like a lot of biological variability within the sample. So labs are not that accurate. People think that like that number it's like 30% variation even within the sample. So there's statistical variation, there's analytical error within the laboratory testing, and then there's biological like variability as well. And so hormones.
So should they just be looking at comparatively their own results, like get quarterly over a year and kind of just look at what the numbers say? So the quantitative data and then qualitatively how you feel and even mood, body composition.
I wish I could say there's a lab test that would help women. So like, it's really like the only lab test that really helps women is an FSH. So if you're looking at something that you can compare over time or something that you'd want to see, so FSH is called follicle stimulating hormone, and it is released by the brain, and it is like, tells you what the brain is thinking. So like you're not relying on these absolute levels in the blood. Like, is it high or is it low? Or like, we don't even have reference intervals established for women. We have an appropriate optimal reference range for men. Like, that, hey, if you're 1,000 or like 1,500 or like somewhere in there, you're optimal. If you're at 500, then you're not. Like, we know that for men. That's been well established. This has not been established for women. There are 5 papers in the entire world on optimal reference ranges for progesterone. So like,
why do we have this range nailed down for men and not for women?
We know there has always been a gender data gap for women. We have always done the studies on men and we try to apply them to women. Like, we're not tiny men, but they always try to do that. So like, even the testosterone, we have established testosterone reference ranges for women. I just want to say that but our own primary hormones, estrogen and progesterone, testosterone is not our primary hormone. It's a male hormone. Like, I just want to, we have it and it's important, but it's like, we need to establish our own. And so I think women don't even understand that even if they get these labs, that doctors don't know how to interpret necessarily. Like, if you get a good experienced one, they kind of know to ignore the lab. So like, they'll get the lab, but like a good experienced one will be like, what are your symptoms and what are they looking like? And then they try to put it into to see if do the labs match the clinical picture. And if they do, then the labs are supportive of what you're already thinking, but you should never just use the labs and try to follow them. Like, if you're a biohacker, for example, and you're trying to like optimal health and you're a 33-year-old and you're like, I just want to follow this trend and see when I need HRT, you're going to be you're going to be disappointed. But like, there's something about an FSH might help you. So an FSH, if you get it like on the 3rd day of your cycle, and then you, which means like kind of towards the end of your period. So if you like wait and then you get an FSH, if an FSH is 9 or above, it basically shows that what happens is when your ovaries start fatiguing, there's like a thing called ovarian fatigue, like you're fatiguing your ovaries, they're just not working the way they should be. The brain will start panicking. So it starts releasing FSH, like, because FSH will stimulate the ovary to make more hormone, right? So the brain is like, let's get it together, start making more. And the ovary cannot, right? So the ovary cannot respond because it's not able to. It won't make any progesterone, which is our main hormone, but it will sometimes make this like spurt of estrogen, right? It's like, it's still able to it's like trying its best. And then the adrenal glands can still make testosterone. So you'll get this funny picture of like no progesterone, lots of estrogen, some testosterone, maybe plus or minus, I don't know. And then you'll get a ragingly high FSH, but nobody gets the FSH, right? Everybody just looks at the estrogen and they're like, you have high estrogen, you have estrogen dominance, you need to lower your estrogen. So this is where women are like confused, because then they're told they spend years trying to avoid estrogen. And that's the very thing that they need, because what happens is the brain, it's like a marker of, so they could, if your FSH is normal, that means that the brain thinks that there's plenty of hormone around. The brain is not panicking. It's like, I think I have enough for what you're doing. If you start running marathons or doing something crazy, then
Introducing high stress. Yeah.
Yeah. Or like if you start, like doing a lot of more stress on the body or whatever, then we might need more hormones to support us. And then I will release more FSH. But at this point, I have enough. But if your brain is releasing a ton of FSH, so this is a marker that young women could follow, then that just shows that you are not making what you should. And then what happens when you take estrogen? So women always ask, my estrogen's high because your ovary happened to make these like spikes. When you take estrogen, it calms the brain, and the brain stops releasing FSH because it thinks now, okay, I have enough hormone around. You're giving me plenty. I'm okay. I can relax. And then you suppress your own function. So men intuitively know this. Like men take testosterone therapy and they know that it's going to suppress the testes. We know that. And that's why you get some like physical signs of that suppression. But they already know intuitively that they're not going to make it themselves. Women have not been told this or taught this. So they think that you're adding to their already existing hormones. You're like, no, I'm going to suppress your ovarian function. Your ovaries aren't working, girl. Sorry. Like your ovaries aren't working well enough. So like, right. So we're going to suppress those functions so that and then I'm going to give you plenty of hormones to support you, to make you feel better. And this is something they could do. They could follow an FSH.
Well, so you're saying, just so I'm hearing this correctly, this hormone matters more than estrogen in terms of monitoring, but it is even more important to go off of when it is tested in your cycle and how you feel compared to just the number on the paper.
You're right. Yeah. Like women are going to be really disappointed if they try to get these absolute levels in perimenopause or any other. The only time an absolute level is helpful is menopause. And that's when there's zero. So you're just like,
and at that point you're like, okay, thanks.
You're already 50 and your period stopped. Why did we get a lab? You know what I mean? Like it's at that point, it's like pointless. So, and then the FSH is like 130 at that point, right? So you've waited way too long. And like, so women, like we have really done them wrong. Like we've told them, hey, you can't start HRT until your period stops. You need to wait until menopause. You're 30, you're normal, you're too young for this. Like there's nothing that we can do. We can't do labs. We can't follow it. And this is really, we've been ignoring this problem. And so instead we can tell a 30-year-old, get an FSH, like listen to your body, listen to your symptoms. You know that you feel differently than you did a year ago. How long do you want to put up with that? Because it just keeps getting worse from here on out. And I think that's where right? Like,
but I mean, the point there is really, it's, do you feel differently than you did a year ago? And I want the listener to really hone in on that because you don't have to accept that. You don't have to just go, of course I feel differently because I'm a year older, or I had a kid, or life is more stressful, or I had insert any major life event here. We shouldn't have to accept any of these things. Now, yes, they play a role. They are a variable in us in terms of energy and, outlook on life and just, mood and a lot of different things, but we don't have to accept that as the end all be all equation for our current snapshot of health.
That's right. Women, like you don't have to accept any of it. And not only that, like not only can you feel good, you can look good. Like you can prevent wrinkles, your hair can look great. Like everybody wants beautiful skin and hair as they get older. Like there's like everything that testosterone gives to men, which is like what they're looking for. Great builds, weight gain, great hair, like whatever, I mean, testosterone, like people intuitively know that testosterone is great for men. So like women need to be thinking the same, like testosterone, like when you see a young fit man that he's got high testosterone, that's what you can have as you age. Like if you keep that level like appropriate, right? So if we think about hormones in this longevity, anti-aging, the foundation for anti-aging, women need to also think about themselves that way. Like estrogen and progesterone are our way of getting that physique and skin and hair and libido and like mental drive and clarity and zest for life. That is what we need in order to maintain that as we age. Just like men get that from testosterone, but we're not quite, we need to like make that shift culturally. Does that make sense?
Yeah. And it totally is possible. Now I am a man, so I can't speak for the female side here, but again, as someone who went on hormone replacement therapy, testosterone replacement therapy, again, barely a year and a half, it was like 14, 15 months. From before TRT, I was in like low to mid 500 range. Now I've been off of TRT for next month will be 2 years, and I'm able now to keep my numbers in the high 700s. And I'm very happy with a lot of things in my life that I was looking for with TRT. But, the show isn't about me. Let's get back to the female health here. But I just want to shine that light that, awareness is step number one. And after that, you might need some hormone replacement therapy. But then even getting off of it, there are ways to like keep your numbers elevated, but also like qualitatively, there are ways to like make sure that you still feel how you want to feel regardless of your age. For the first time ever, I felt my age. At 36, I finally felt like a lot of people I heard say when they hit 30, like, oh, I'm 30 and now this hurts, or I can't keep up, the mood, the libido, the body composition, whatever. And for me at 36, I finally felt like I hit 30. And now I'm right back in the same game. I'm totally happy with everything.
I love it. And you bring up a good point that like women, the educate, like the kind of awareness is the first thing so that you can, it doesn't mean, I think women think of like TRT for men. It's more of like you used it as I'm going to get it through this like 18-month hump. And then you made a lot of changes potentially, and you were able to like now do it on your own, for example, and
yes.
It feel really good.
Yes, yeah.
That's a good way to think about hormone levels because it changes throughout our life, and who knows what you're going through when you needed the TRT. You know what I mean? Like what if you stressful period, whatever, and that can help you through that. And then, but women tend to think about HRT as a finality. Like once I started, I can never stop, and I have to wait until I'm menopausal, and it's like this end of like second half of my life thing.
And that's just not true, right?
It's just not true. So like if they looked at it as like, this is the ultimate biohacking. This is like biohacking for the women, for the masses. Like you can do all the other things that are out there, like the cold plunging, the saunas or whatever, but nothing is going to get you where hormone replacement therapy will. So it's like going to be the biggest bang for your buck, for like a lack of a better, like this is, if you were to maintain your optimal hormone levels, you will maintain your health, but you can start and stop it. So like, or let's say you're 29 and you're like, I don't know, maybe I want another kid, or I don't, like a lot of people don't know their family planning yet. And that's okay. Like HRT does not mean that you are never going to get pregnant again. In fact, a lot of women get pregnant on hormone replacement therapy, and they do it. You can do it postpartum to get you through that postpartum phase. And then you can, try to get off of it if you'd like and see if you can get it through lifestyle modification. If you can't, that's okay to go back on it. It's not a sign of weakness if you need to go on hormone replacement therapy. It's not a sign of anything. It just means that you are doing the best thing for your body to maintain health. It doesn't mean anything about you. And so if they just looked at it as like, it could be temporary and it could be in between your phases of life, and it doesn't mean that we're going to take away your fertility. I think a lot of women don't understand that you actually keep ovulating on hormone replacement therapy, on the right hormone replacement therapy.
Oh, wow, really?
Pregnant on it, yeah. So, and just like men, when they're on testosterone replacement therapy, are still fertile. It just depends on, you don't want to give them too much testosterone, right? If you give them too much, then you can take that away. Because it suppresses LH too much. But it's the same thing with women, is if you're doing it right, you shouldn't become infertile on hormone replacement therapy. So young women should absolutely be thinking of this as a way to
define young women for us. What age range is that, or under a range?
21 and above, like, just like we would for men. I mean, even, maybe 18 and above, but I still think 21's our cutoff, for example. Really thinking about keeping you healthy your whole life. Like, I wish I would have had hormone replacement therapy some years in college, right? In medical school. And it's like, you're so depleted and you're so burning both candles, wow, whatever the saying is.
Burning the candles at both ends. Yeah.
But it's like, everybody's really trying to do everything now. Like, and then, women in their 30s, they have kids and jobs and relationships, and they're trying to keep it all together and maintain their weight. This can be just part of that to support you.
Wow.
Women are getting Botox in their 20s to prevent wrinkles. They should be instead be thinking about hormone replacement therapy and estrogen progesterone are a natural way to prevent wrinkles. Like, are my levels optimal, or does my skin look terrible because my hormones are dropped? Instead of getting like a intervention, maybe they should look at health. Because health needs to be the measurement, right? And then you win. Like if you're always measuring your health, you're always going to have good weight loss and great skin and hair and like all, libido and mental clarity. Health is what you should be looking for, not a quick Band-Aid on something.
Absolutely. So I want to get into two other areas here as we kind of get towards the end of our interview here today. I want to first talk supplementation. And then I'm going to get into the areas of perimenopause and menopause. I know you've kind of hit on them a little bit, but I would love to have you kind of just really hone in on what is perimenopause, what is menopause. Let's look at age ranges, break them down in terms of, the signs, protocols to properly manage and things of that nature. But first, supplementation. Maybe before we get into considering HRT, TRT, or any kind of hormone, exogenous hormone replacement therapy, what supplements, if any, would you recommend to the general female public for supporting hormone health and navigating perimenopause and menopause?
Yeah. So unfortunately for women, supplements don't work. Like if you're thinking I think you mean like a herb or something that might support them?
Yeah. So my mind automatically goes to, for guys, a lot of us will take, myself included, to support hormone health, specifically testosterone. Like I daily take zinc, vitamin D, Tungcat Ali, and magnesium, some key minerals and things like that I have used for about a year now. And I've seen by my labs and how I feel and look an increase in testosterone, muscle mass, and things of that nature. Are there any, related supplements like that for women that they can use to feel and manage better?
Yeah, I think vitamins are great. Like we all need like zinc and magnesium. I think women need like a bigger impact. I do think men are easier and they're practically different species. And I've been successful. I think men are more successful when they implement lifestyle changes and diet and change like some supplements and herbs to raise free testosterone, and they'll notice a difference.
And ashwagandha is another one. Yes, for guys.
The problem with a lot of these herbs is that they raise testosterone. They don't raise estrogen and progesterone. So ashwagandha raises testosterone in women. And so when you have a woman that's completely depleted and you put her on an herb like ashwagandha and it raises testosterone, she could feel very irritable. So you're not really giving like her the balance that she needs or these protective hormones. We do not naturally make herbs. Like our body does not make perimenopause is not an ashwagandha deficiency. So I want like women, like, and I know, and I get what you're saying, like we're totally different than men. And I've taken an approach with like a young man that I could potentially put him on herbs. There's a lot of herbs out there that help them. But women, I've never been successful with women because one, like progesterone is really hard to make, I think. And to get an herb to stimulate that hormone production, chasteberry doesn't work that well. Like that's our herb Vitex. And it's like, women don't notice it as much as they need to. Like, I think if you had somebody who just wanted to support it, that would work. But somebody who's really depleted, you've already taken somebody who really needs like a lot of help.
Okay, so right there, I think is an important note. So this is where we should know our levels. A woman should know her levels to see if she really is in the depleted state, the far end, the negative end of the spectrum, compared to maybe someone that could take certain supplements and herbs to kind of just get a boost or kind of just like more of a feeling. But I'm hearing it really depends on the number.
It's really like you're talking about like a healthy individual that's like not having any problems, who wants to do some biohacking. And I mean, but she needs to keep in mind that a lot of those herbs raise testosterone, not like maca root is testosterone raiser. They're very effective for men. That's the thing. It's like, so, but women, by the time I'm seeing them, they have really heavy, painful periods. They have been going a year without progesterone. They're like struggling with anxiety and depression and irritability.
So there's really no supplements that women can take to effectively, noticeably improve their hormones. No,
and not only that, there's an argument that they're not natural. So if you buy a random supplement off the internet that's an herb, like we don't make turmeric, like, and you don't even know if that has turmeric in it because the FDA doesn't care. They just regulate the label. They don't actually regulate what's in it is in it. So like you're kind of like, I think people think it's safer to like start with an herb. And it always blows my mind because it's like, first of all,
you look at things like Ayurvedic medicine or, Eastern medicine that have been using, you have a lot of anecdotal evidence, but also thousands of years in some cases of like human experience that I think a lot of people take value in.
Yes. But I'm not a believer, like we don't really know how they work. Like for example, black cohosh, it just raises serotonin in the brain. So it kind of might start like stop your hot flashes at first for like the first week, but it's not going to like protect your bones and heart. And it's not going to prevent dementia and Alzheimer's.
Like you would get with like estrogen or actual HRT.
So like the most natural thing you can do is actually supplement with your own natural hormones. Like we can isolate them and give them to you, estradiol and progesterone. Like there's nothing more natural. than just taking your own hormone. Like no herb, like we don't know how the herbs like are interacting with the receptors. They may or may not do the same thing. They're not the most natural thing you can do. I get that people think that it is. And I think it's more natural than a pharmaceutical. And I get that. And I agree with, everybody on that. But my argument is that like, you're never going to get the results with an herb ever that you will with hormones, right? For a woman. And progesterone is our Xanax. It's like nature's Xanax. Men do not have this problem, but like women need progesterone to bind to the GABA receptors in the brain for her to feel calm, for her to feel like herself. Testosterone helps men feel calm and like centered and confident, but nothing like a woman. She actually like needs it, or she feels like earth is like falling underneath her, like her world is falling apart. So this is like a different feeling than men. Like I get the men need like a boost. Women need like that to function. Does that make sense? So
yeah, okay.
I think women are like caught into this. I need to do this first and change my diet first. And the only thing that really helps with hormones on that like a big scale that you're talking about, like, to make an impact, like, hey, if you really want to make an impact and you're 25 and you want to try something, and you were to come to me and I'd be like, if you could try one thing, it wouldn't be an herb. It would be to like change your diet. It would be to have women need to maintain their blood glucose and make it really stable. And if they don't, they'll see like huge fluctuations in their hormones. So like, everybody loves fasting. It's like the thing now. I get it. Like, and all those studies probably based on men, and for men, it probably works great. And fasting mimicking diets work for them. But for women, fasting doesn't work. And if you're on continuous HRT or not, like you'll see women will do a fast and they'll get a ton of symptoms, anxiety, depression, irritability, because the machinery picks up and depletes them of their hormones after a fast. Like they need to be really keeping a stable blood sugar, and they need a lot of protein. Like, women think that we've just not really been trained like men have in nutrition science. Like men intuitively know they need to eat more and eat protein, and then they are healthier. Women are dieting and trying to lose weight, and they don't eat as much protein, and they're the ones that like we're built to build babies. We actually need like over 100 grams of protein to do that. And so if you were to do one lifestyle change before you started HRT, it would just change your diet to actually eating more protein, eating throughout the day, like combining a fat and a carb and a protein together, right? So that you're keeping your blood sugar stable. And then try this for several weeks with the protein intake. And if you are still like, and eliminating like a fragrance, like you can do like a few things. Then you're not like, it's not going to be an herb, and it's not going to be zinc. I promise.
I'm so glad you brought this up. Actually, I had a question down here. I didn't know if we were going to have time to get to it around women and fasting. I've had some incredible fasting content on the show as of late. I had a longevity, registered dietitian, a longevity nutritionist on the show recently, Renee Fitton. The episode did incredibly well. It's just an hour and 40-minute fasting masterclass. I never knew I would be so enthralled about fasting, but I do see a lot of difference of opinion and just even experience with women in fasting compared to men, particularly around fasting and their cycle. Does fasting even work? Well, does it work period for women compared to men, especially when looking at hormone management, longevity, and weight management, especially?
So looking at all three of those, let's hit them all. So like in terms of hormone, we already talked about that. No, like you will get symptoms if after a fast, because you've been depleted, you will deplete yourself of hormones. That it's possible that these genes just pick up and like metabolize quicker. And then in terms of longevity, if you were to do one thing to activate this autophagy and longevity, it's not fasting. It could be a sauna. And I know this sounds like weird, but like that we have more studies and more data and better studies on longitudinal data on sauna use for longevity than we do on fasting. So I know this like fasting.
Is this just for women? Sauna use over fasting works better for autophagy and longevity compared to fasting for women?
For women. And there's other things that activate this, if you want to get rid of your zombie cells, there's other ways to do it, right? So like you can get rid of it, like green tea extract. Like women should be drinking green tea like every day, or like taking a green tea extract like matcha tea. That activates it. You can do that in combination with saunas. Rapamycin will do it. I really think that there are maybe better ways than fasting for women to activate this autophagy for them. And there's other ways to get rid of like old damaged cells like glutathione. We have tools now, right? So like we have some other tools in the toolbox for women. And the studies that were fasting studies, I would just argue that they're just not like, I used to be a big fan of fasting for this reason, for longevity, because I'm a longevity expert and I used to do it myself. And women, they actually do poorly after fasting. One, they get like the wheels fall off the bus, they eat worse. Like, how is that better? They gain weight, they don't lose weight. Majority of women are fasting not for longevity, they're fasting to lose weight, right? So you're not like, if you want to lose weight as a woman, you keep your blood sugar stable, you will lose weight. And again, if weight loss is your only measurement, right? Like if you're just looking at weight loss, it's not going to happen.
It's kind of like right goal, but just wrong tool.
Health needs to be your measurement, right? If you're looking at like my mental fitness, my sleep, my circadian rhythms, my diet, my skin and hair, my overall well-being, my libido, my estrogen and progesterone levels are great. These are my measurements. You will lose weight, right? Like, so like, I think we as women tend to be like, I just like the scale's the same. Like, I'm like, and then that's your measurement. You're going to lose, like you get nothing. But if you change and flip this like idea about how you approach it, and if you keep your blood sugar stable, every time we get a spike in blood sugar, we age. Right? So like blood sugar, insulin and glucose, like this pathway, we every time we have blood sugar that's free, like in the blood, it causes us to get age rapidly. So if we were to maintain this, so like a low carb diet, that's why the like low carb carnivore diets like are really great for anti-aging. You don't have to fast, and you can like just be a stable blood sugar the entire time and get your longevity effect that you want to, right? And lose weight because you're now in a calorie deficit, theoretically. Like if you do
right,
yeah. Right, okay. And then you're not depleting your hormones. So you win and you're not doing any fasting. And I think women should consider this because
fascinating.
I just think it doesn't need to be studied more. Like diet's really hard to study in a long-term sense. We don't even really, like none of the studies we have are that great for whether meat's bad or vegetarian, like all the, if you look at everything, they really don't make a big impact. Like if you look at what things do make an impact on weight loss, it's sleep, hormone replacement therapy, like these have a bigger statistical
and calorie deficit.
Yeah. These have a bigger statistical significance on studies than any like vegetarian versus meat eater, like this kind of stuff. Like, I don't think people really, at least from the studies, like I think just people need to do what's right for them. But does that make sense? Like I think
interesting. Yeah. Really interesting stuff. I feel like I could spin off a whole nother episode with you on just this last like 3 to 5 minutes here alone. That was really, really interesting information. I want to be mindful of our time, and I know we're actually kind of like a little bit over here. Do you have a few more minutes?
Sure.
So I wanted to get into, before we wrap up, the aspects of perimenopause and menopause. If you could please kind of just, high level, just especially for women in these age brackets or places chronologically in life, just kind of maybe wrap their head around all the other information pieces we were talking about. If you could break them down for us in terms of what are the signs and what are the protocols, again, generally speaking here, to properly manage them? And what does this really mean for a woman? How can she view this biological season of her life as a time to really dial in her health and not a shortcoming or, oh my God, this is just, another part of being a woman that I have to accept and it's downhill from here?
Yeah, I love that you said it. It's really just like a time that they can take the opportunity to make changes and like thrive after that. So menopause is really the only thing we can define as like when the period stops for 1 year. And that's it. That's like all it is. Like it's but there's this whole, what about the 30 years before that, I think is what women need to be thinking about. And instead of defining perimenopause, we get hung up on the definition, what age does it start? So then even if I were to say perimenopause tends to start at age 30, this would be really unfair for a 25-year-old who's really suffering and going through it because she thinks she's too young for quote unquote perimenopause because she's not even close to menopause. So, because she could go through this for her whole life and still have a period and not be menopausal, right? So I think we need this definition thing when, just like we say, well, for men, we don't tell him he has andropause. Okay, you stopped making sperm for an entire year and now you have andropause. And we don't tell him that he's periandropausal, right? So you're about the time when you're going to stop making sperm. Like nobody talks about sperm production in men. Like, why?
Yeah, I never talk to my guy friends at the gym or getting coffee or something like, oh, what's up, man? Oh, I think I'm periandropausal. Like, no, No guy says that. No,
it's absurd because it's
and therefore, which also, like, we joke, but it's also, we don't wrap an identity around it. And unfortunately, I think for women, because of the terminology and the experience with their providers and just, past history, that becomes an identity, and it doesn't have to be.
Yes, you're absolutely right. Like, we're doing this like to ourselves, and it's really it's kind of devastating. So like it's this, we don't have to like tell her that she has to be within 5 years of her periods. Like, who knows when your period's going to stop? Like, I have a magical crystal ball and I'm going to predict, okay, you're going to stop your period at 54. So you need to start HRT at 44. Like, that's absurd. So, which is what we're doing to women kind of like, but instead it just says, look, your ovaries are not supporting you, whatever's going on in your life. Like, if you have a lot of stress, they're not your nutrition support, whatever, or the environmental factors, your ovaries cannot do it. And you have low estrogen and progesterone. Just like we would tell a man, you have low testosterone right now. You know what I mean? And like, these are your options and what you can do. We would just need to tell, and she just needs to realize that it doesn't mean that she's an old woman, menopause. Like, I don't know what women think. They just think I'm not perimenopause. I even told like a 38-year-old the other day, well, it's perimenopause. And she's like, oh, no, that's not me. Like, I'm too young for that. And so instead of there's so much shame around the word menopause that we just need to say, look, your ovaries are fatigued right now. Like, they're totally like, you've maxed them out. You have low estrogen and progesterone. Like, you're exposing yourself to all these environmental chemicals. Your receptors are free. You're going to get, it's not going to get better unless you can try, like I said, the diet, I guess, and some other things. And there's this option for you of hormone replacement therapy. And this would change a lot for women and take it out of, instead of blaming them. I think we're still blaming women. This is your fault. Like, a lot of the messaging is still about blaming them instead of just saying like, hey, it's okay. We have a solution for you. Like, it's not a big deal. Oh, I lost you. Your sound.
There we go. So before I get to my final question here, give us a mantra, this mindset, this perspective shift that a woman can begin to adopt or even consider to, turn into her own, to really begin to rewrite the narrative of perimenopause, menopause, biological age, chronological age, and just step into this period of her life more empowered so that she can view, yes, there are changes that are happening to my body, but I'm going to use this as information, not, for lack of a better term, a death sentence here.
Yes. Like, the message is, this is actually amazing that you get to feel and look good as you age, that we have the opportunity to do this now. Most women are like, I don't want to have to take something forever. Like, they're depressed about it. They're almost like they get depressed that they've reached this point in life where they're now having to supplement hormones because they can't make them anymore. But instead they need to be like, this is amazing. Like, I feel better now than I did in my 20s because I'm now consistently like supporting my body with the health, with these hormones that I never maybe even consistently made them before, because women have to have all the stars aligned in order to make hormones. So it's like, this way you have complete control. And how powerful is that, to have control over the way that you age? So something so foundational, and getting away from like this idea, your own hormones are the most powerful. They're like CEOs of your body. They're the most powerful thing that you can do for anti-aging, longevity, overall health, disease prevention, and feeling and looking great. And you have control over how much you can put it on your body and like inside, and like feel great.
That's incredible information.
Why would you wait? Like, why would you wait until you're 40? Oh, shouldn't you be thinking about this every year? Okay, do I need to start HRT now? How about now? Knowing that it's coming, knowing like 20-year-olds listening should be like, it's going to come. It's universal. Everybody goes through it. Like, kind of know when your point is. There's no shame in it. There's no sign of weakness, and there's no badge of honor for waiting until your period stops. Like, women are like, oh, I didn't go to menopause until I was 50. It's like, okay, so what? Like, so I went through it when I was 36, whatever. You know what I mean? Like, it's like, if women were to normalize it and be like, I want to take control. And as soon as it starts happening, I need to get on top of it. Because then, like, if you go a long time without hormones, your body deteriorates. You've basically aged during that time that you were low. So if you can minimize the amount of time that you're low, you can prevent a lot of problems. Like, it's hard to treat heart disease, but it's really easy to prevent it. Right? Like, that when you get heart disease when you're 55, you should have been thinking about it when you were 35 or 25. And so
it's the same thing here.
Exactly. So women, and just take it's actually like, who would not want to feel great? Why would you, okay, I'm going to go another year and I think women are like, well, I'm just going to push it out as long as I have to, because I know I'm going to have to keep taking it. But they shouldn't think about it that way. They should be like, well, why don't you just take it for a year so you can feel great this year? And then figure it out next year, like you did. Well, maybe I don't need it. Maybe I can do something else and try something else. And if it doesn't work, it's okay. I can still take HRT.
Well, hopefully this information, this episode has begun to help rewrite that narrative and begin to get the listener, the viewer, just to hypothesize what it would be like to think differently about their age and numbers on a lab, but also how they feel. And all of this, the numbers on a sheet of paper and how you feel, it is all pertinent information that you can use, should you choose to empower your life and to empower your health and to make the next best choice possible for you. Which leads me to my final question, which is what the show is all about. Through our hormones, through our mindset, through physical fitness, wellness, relationships, all these different components of well-being, so that we can bring awareness to them and help move us forward and keep living a life ever forward. So Sarah, those two words, what do they mean to you? If I were to ask you, how do you live a life ever forward? What would that mean to you here today?
I think you can always tell how old somebody is by how they talk. Like you can tell how they feel about themselves and their age. If somebody is always talking about their future, like if they're always talking about the future, they're young. That's a young person. If you're talking to a person and they're talking about the past, that person is aged, right? Like they're pretty much don't think that there's a future ahead of them. And so if you're always thinking about that in the way of youth, and like the always forward, like that ever forward, like I'm going to constantly thinking about the future, because that is just like how I maintain my youth, right? And there's always something ahead of me. I'll never, like, I very rarely talk about the past or something like that, and you always know how old people are, where they're at in their journey by how they reference their future or their past.
What a great answer. I really, really appreciated that one today. What a really unique answer. I always tell my guests there's never a right or a wrong answer. I appreciate every interpretation, and I know my audience does as well. Sarah, where can they go, speaking of, to connect with you, to learn more about HRT, female health, longevity, hormone health optimization, all the things we've been talking about and more? What's the best place to connect with you?
We have a lot of information on our social channels, which is Sarah, my name's Sarah Daccarett, MD. So you can go there and like learn more, or YouTube, I think TikTok's the same. And then we post more like short videos for people to learn more, or the website is www.innerbalance.com. And we have some information there, or you can reach out and ask questions about your specific, if you want, about your specific journey or anything like that, where our experts are supposed to, we're here as a resource, like while you're doing your research, certainly giving you like some clarity and clear answers in a really highly chaotic market, or field of women are really confused. So even if you just want to come and ask questions, you can do that there. The website or the social channels will get them answered for you.
Amazing. And as always, you guys know that everything is going to be listed down in the show notes and video description box for you if you're listening on a podcast platform or watching on YouTube or the website. Sarah, this was incredible. Thank you so much. I can already tell I'm going to have you back on later on, because so many little sections we were talking about, I just want to go 45 minutes deeper with each one of them. So very well spoken on this stuff. I appreciate your way of interpreting a lot of what could be heavy scientific information that a lot of people maybe don't understand or are going to put the time into understand. But you really transcended things well, I think, for people to at least become more curious about where to go to research and where to look into their own bodies and their own health.
Amazing. Thank you for having me on.
My pleasure.